Hello everyone, welcome to Talking Health with Dr. Laz, your favorite health program on television, reaching you from your channel of choice AIT from Nigeria's capital city, Abuja. My name is Dr. Laz Eze. Today we'll be talking about a health condition that many know about, but very many perhaps may not know about it. But it's a condition that we see and ascribe some other meanings to them. We are talking about a very important organ in the body, the thyroid gland. It's located on the frontal part of the neck. And we'll have an expert who will be joining us from Ibadan via Zoom to talk more about this. I'll introduce him later. But before we proceed, a lot has been happening within the health space. And also for you to know that this program will keep bringing current issues, and there is a segment we'll be introducing in not very distant time on the Make Our Hospital Work, which intends to encourage more community participation in primary health care. You'll be hearing much about that in our subsequent episodes. But today we'll be talking about the prevention and the management of thyroid diseases. The thyroid gland, as I mentioned earlier, is located on the frontal part of the neck. And joining me to discuss this is a senior lecturer at the Department of Endocrine Surgery, University College Hospital Ibadan. He was one of my teachers in medical school at Ibadan, and it's very exciting to have him on my show. And he is also a consultant general and endocrine surgeon, and also the Thyroid Care Association of Nigeria, the founder of this association. So he's very active within the health space. He's been an official of the Nigerian Medical Association, and performs so many other community services, especially as related to healthcare. Joining me will be Dr. Adefemi Afolabi, a fellow of the West African College of Surgeons. So welcome to the program, sir.
Good afternoon. Good afternoon. Thank you very much for having me.
All right, sir. Thank you very much. So we'll be getting into the discussion proper after this short break. And do not forget to follow us on our social media handles displayed on your screen. Our previous episodes can all be found on our YouTube channel at TalkingHealth Nigeria TV. And don't fail to keep, engaging us through our various social media channels. Do stay with us. We'll be right back. Welcome back to Talking Health with Dr. Laz, your favorite health program on television. Yes, we're talking about the thyroid gland, and I have an expert with me joining via Zoom from the University College Hospital in Ibadan, West Africa, Nigeria, Dr. Adefemi Afolabi. Yes, Dr. Afolabi, you've worked in this space for a very long time, and as a surgeon, you've performed several surgeries involving the thyroid gland. But I expect you speak to the public now, and not as if you're talking to the professionals that you are used to teaching almost every day. So kindly describe the anatomy of the thyroid gland, the location in the body.
The thyroid gland is located in the frontal part of the neck of an individual. It is below what we call the Adam's apple, which actually the thyroid gland is enlarged or not. One needs to look at the neck. That is where it will be if it causes as a swelling. It moves up and down when we swallow, because it's related to the gullet. It sits on the windpipe. So they are related and closed, same structure. That is why when we are looking for evidence of the thyroid gland disorder, we usually ask the individual to swallow the saliva or not. So that is where it is located, in the frontal part of the neck.
Okay, that's very good. I'm sure our viewers would have seen that on the screen, the location of the thyroid gland. So what are the functions of this thyroid gland?
Now, the thyroid gland produces two chemicals which are very important in determining how the body uses energy. When we talk about energy, when we eat food, the food we eat, whether it's carbohydrates, protein, or fats, is converted in the body into energy. Now, these two hormones play a great role in how the body uses this energy, to the extent that if the hormone is in excess, we see that we're going to go into this later on, the individual will be using excessive energy, will be hyperfunctioning, and if that person's hormone is inadequate, that individual will be slow. So that, in essence, is the function of the hormones. And we should know that these two hormones actually affect all parts of the body, from head to toe. So any abnormality of the hormone of thyroid gland can actually affect all parts of the gland. But you must say right now that there's a third chemical that the brain produces that enables this thyroid gland to produce two hormones. Okay. So they are all linked. So these three hormones are linked, the one in the brain and the two that the thyroid gland itself produces. So that in ordering for test, usually order for the three hormones.
Okay, so and those hormones are the thyroid stimulating hormone, then the T3 and the T4, right?
Yes, yes.
Okay, so thank you very much, sir. Does thyroid hormone also play any role in child development, or like the neural development of a baby?
The thyroid hormone is so important, as like I said, in order all body, such the fetus in the womb, we need the hormone of the mother in order to develop properly. And this is one of the reasons that the thyroid gland diseases is commoner in women. So during pregnancy, in order to satisfy both the baby in the womb and the mother, the thyroid gland of the mother will enlarge a bit. So because the baby needs these two hormones we talk about to develop the brain, all the organs of the body. And all these developments actually occur in the first 3 months. They are late in the first 3 months of pregnancy. And that is when the baby's own thyroid gland is not yet formed. So this first 3 months is very critical until when the baby's thyroid gland is also formed, when it may take over part of the function of use of hormone. So it is very essential, and we are going to see later on in babies or fetuses whose mother are deficient in the hormone. They are usually born with some abnormality.
Okay.
Some of them are called cretins, in that they will be born small stature, to the extent that their brain function also will not be adequate at the end of the day. But we have got over that now, that there should not be anybody giving birth to a child with that. And that is the essence of this program as well, to educate the public.
Exactly. That's the essence of this program, to educate the public. Thank you for relating those functions in a baby as well as that of a pregnant woman, and the relevance of thyroid hormones in pregnancy. So let's quickly go to some of the things that could happen. From the physicians, we could talk about hyper or hypothyroidism, depending on whether we have, excessive or reduced expression of these hormonal functions. So, but we'll take more from the one more interested to you as a surgeon, the one that could present physically and might require surgical interventions. So in cases of hypothyroidism, where for one reason or the other, we do not have sufficient availability, or perhaps it's available but not quite utilized by the body. I mean the T3 and T4 hormones produced by the thyroid gland. So what are the health conditions that this could present us, and how can we prevent them?
Now, we have mentioned the hypo and the hyper. So the normal is called euthyroidism, that is normal thyroid function. When we measure the hormone levels, they are normal in the body. So the individual is fine, has no disease of the thyroid gland. And that is what we desire for everybody. However, if for any of the reasons we are going to start mentioning now, the thyroid gland is not producing enough hormone. For example, one common cause is lack of adequate iodine in the dietary iodine, due to the diet or the area where the individual lives. It has been found that people who live in mountainous or hills, over in areas that are hilly, that the topsoil is not very good in iodine. So the plants, the food, the water they drink may not be adequate in iodine. So that will reduce the amount of hormone produced, because the thyroid gland depends on iodine to produce these hormones. What then happens is that the brain hormone that we call the thyroid stimulating hormone will now be increased to encourage the thyroid gland to get big so they can produce enough hormone. So in getting big, the individual will now see that the thyroid gland is enlarged in the frontal part of the neck.
Okay.
So hypothyroidism will come to a stage whereby the hormone is not enough, the brain hormone will be increased, and then the thyroid gland will get big. So that is one of the ways the thyroid diseases manifest, almost all of them, enlargement. Now, moreover for thyroidism, since the level of the hormone is not enough, the individual use of energy will not be adequate. So the individual will be slow, will be feeling sleepy, may sleep too much, may have loss of memory, will not be able to calculate ordinary mathematics, and every other thing that one does. It may even affect the individual's menstruation and fertility to that extent. Wow. The individual will not feel like eating, will be gaining weight, because the hormones are not there to burn down the energy or the food that the individual is able to eat. So we'll be feeling sleepy. The voice may become husky. So a female who sings soprano, they start singing bass in the choir. The leg may be swollen in some area. And more important is that the individual will not be able to tolerate cold. Wow. Somebody who likes enjoying air conditioner before, when it becomes hypothyroid, will not be able to endure the cold environment or when it is raining. Whereas other people around that person will be able to enjoy the cold environment because their own gland will be able to produce the hormone we are talking about. This individual's gland cannot produce the hormone to produce the energy, to produce the heat that the body needs. So that is how the people who have low hormone, which you call hypothyroidism or low function of thyroid gland, present to us majorly. Wow. Now, the other side of the coin is those people whose glands are functioning excessively.
Okay, sorry, I'll cut in here. We'll get to
the commonest cause of
sorry, sir, I'll cut in here. We'll get to talking about that of hyperthyroidism. I will get to talk more about hyperthyroidism, but let's take another break. When we return, we'll get into the other aspects of the discussion. But a key point has made talked about simple goiter, and that's the swelling, and he has broken it down to the level that anybody could follow through. But let's take this break. When we return, this conversation continues. Do stay with us. Welcome back to Talking Health with Dr. Laz, your favorite health program on television. I've been with Dr. Adefemi Afolabi, a senior lecturer at the University of Ibadan College of Medicine, and of course, a general surgeon at the University College Hospital Ibadan. We've been talking about prevention and management of thyroid diseases, and he has taken time to explain the anatomy, the functions, and of course the features of hypothyroidism, common, which presents with neck swelling, as well as other features he had talked about. If you missed that part, of course you get it on our YouTube channel. So going back to Dr. Afolabi, who is also the founder of Thyroid Care Association of Nigeria. So Dr. Afolabi, let's get to hyperthyroidism very briefly, and also the malignancies, some cancers that might affect the thyroid gland. So the hyperthyroidism, okay. What are the features?
So briefly, hyperthyroidism is a state where the thyroid gland is producing excess of the hormones we have been talking about. And the commonest cause is one of disease in which the body produces some substances that literally encourage the thyroid gland to produce excess hormone. They behave like the brain hormone we talked about earlier on. So the thyroid gland produces sex hormone. In this type of grave disease, the eyes can be protruding, become prominent in some of them. But those who don't have grave disease may also have hyperproduction of the hormone. What we see is that they have too much energy. They are hyperactive, they are restless, they sweat, they cannot tolerate heat, ordinary heat, temperature, they will be feeling sweaty, their palms will be wet, they are not able to sleep. And they also may have, for the women, they may have hormonal changes, menstrual changes that may lead to infertility as well. They eat excessively. Since they are burning too much energy, they eat so much, and despite this, they lose weight at the same time. So these are some of the features of the hyperthyroidism. Since it affects all parts of the body, their hair, they may be losing their hairs, their fingernails may be brittle, they break easily. So they also have some skin changes as well. Those are essential features of hyperthyroidism as against that of the hypo we talk about. For the cancers, now this is the trick. Now we do not know that the patient has cancer if when the thyroid gland is swollen. So all the patients who come with swelling in their frontal part of the neck, who we say have goiter, they actually have cancer in it. What our research has shown is that if you take 10 people who have cancer of thyroid gland, we are only able to detect maybe 3 or 4 of them before surgery. And those ones are those who come very late. Cancer spread to other part of the body. So the remaining 6, we don't even know, despite all the tests we do before surgery, until we have taken out the entire gland and find cancer in it. And a different form of cancer. But the good news is that when the patient comes and they agree that we remove the gland, especially the entire gland, and we identify the cancer, we can give them further treatments, like radiation treatment, and the lifespan expectancy is very high with thyroid cancer. There are people who have lived 30 years, 40 years after their thyroid cancer has been discovered. Okay.
So one might want to ask, when you do surgery to remove the thyroid gland that is enlarged as a result of cancer or hypothyroidism, how do you replace those hormones that they produce?
Now, I'm happy you mentioned this because we have tended, for the reason I gave earlier on, that we don't know whether there's cancer or not. And the fact that even if the thyroid gland is enlarged because of inadequate hormone and it has got big, when we take out part of it and leave part of it behind, it will come again, it will get big again, even though there's no cancer in it. Now, if there's cancer in it and we remove only part of it and we left something behind, we have to go back and take out the remaining part we left behind. So nowadays, we encourage our patients to have the entire gland to be removed so that they can have further treatment. Once we remove the entire gland, either for cancerous or not cancerous reason, there are available tablets of thyroxine. Whereas very small tablets that are available, that have been manufactured, that they will take every day.
Okay.
So, okay.
Are they affordable?
These drugs for life, but it gives us an opportunity to be able to control how much drug they take instead of leaving something small behind, and they come with fertility and so on and so forth. And for those, unfortunately, who have cancer, we take out the entire gland. We can take other treatments and be on thyroxine. We should not leave any cancer behind if there is cancer of thyroid gland. So there is drug they can use. Replacement therapy, we call it, with L-thyroxine.
So are those drugs affordable?
They are available. They are available.
Okay.
The one that was not available recently, which this program will help us in people have hyperfunctioning of the thyroid gland, thyrotoxicosis. The drug is called carbimazole. It wasn't available at the point in time, but it's now available maybe because of the importation of the drugs and so on and so forth. Maybe when our pharmaceutical industry are able to manufacture those drugs, they become readily available. The carbimazole is getting more available now. Thyroxine is readily available because our patients are using it. Our pharmacies are stocking it. So they're available as well.
Okay, so those drugs must be taken only with prescription and the guidance of experts like Dr. Afolabi. So how do we prevent this? Primary prevention. Are there foods, that are helpful in making, you've mentioned the iodized salts, which many of our salts are iodized. Are there other foods or things that people could consume that will help in their thyroid functions?
Okay. So the disease that are within our control to prevent are those ones that are probably due to insufficient iodine in our diet. And the government, more than 15, 20 years ago, had made it a policy that our salt manufacturer should add iodine to it. So that even if somebody's natural diet doesn't contain iodine, the salt that we put in our food will contain iodine. Okay. So that will reduce the number of people who have goiter. That is enlargement of the thyroid gland due to inadequate. The one in which baby is born with an inadequate level of hormone as well. That means the mother also must ensure that her hormone level is adequate so that the baby can have enough in the womb, can have enough thyroxine during pregnancy. That one too is preventable. Okay. Now, those that will not be preventable are those probably that are due to inheritance, genetically inherited diseases. The gene from the father or the mother, the baby will have it, they can discover it as early as possible. Those cancers, iodine will not prevent cancer. Iodized salt. Iodized salt also will not prevent those whose body are producing substances that are against it. We call it autoimmunity.
Okay.
So there are some we can prevent with control of our diet. There are some that we still manifest, but when they come early, we can treat them early.
Okay. So the key to this is people should take iodized salts. The nutritionists have also said some foods like egg, fruits, vegetables, fish, and some others also contains iodine, selenium, and magnesium that also play a role in the production and the use of the thyroid hormones. So for anyone who possibly joined, we've been discussing thyroid diseases, prevention and management, and Dr. Afolabi, the founder of Thyroid Care Association of Nigeria, has broken it down on how we could identify this, mostly swelling on the neck. So, but there are other things that could cause swellings on the neck that might not be thyroid, but you cannot know until you go to the health facility. Before we round up, Dr. Afolabi, could you just mention some of those differential diagnoses as we use in medical parlance, or other things that might cause neck swelling, that might also require intervention at the hospital?
In that essence, you can see that there are different causes of diseases of thyroid gland itself that may manifest from the non-cancerous to the cancerous. So when we see any disease of any swelling in our front of our neck, maybe a friend look at your neck, sees that something is swelling, we check the photograph, something is appearing thyroid gland. The other thing is there's a condition that are related to it, that is people are born with it. It's like a cystic swelling that also may be around the area of the thyroid gland. There's a way we differentiate it in the clinic. There are things in the part of the neck, like a grouping of fatty tissue, which we call lipoma. There are also substances in the neck structure we call lymph node that may point to presence of cancer in the throat, or cancer of thyroid gland itself, or it may even be disease of the lymph node themselves that we call lymphoma. So all this may cause swelling in the neck. Okay. For the other tissues in the neck, the muscles, they give rise to cancer. We call them sarcoma, for example. But the important thing is that let us not panic when we see something that is abnormal. Let us come to see the doctor, to the clinic, and then they will be able to identify for us. It's better we come on time, and they will be able to remove it for us. There are some that we just need treatment with drugs. Not all swellings in the body we need operation. So let us not be afraid in coming. Because one of the reasons people don't come on time is fear of surgery around the neck. And you know why? That is why we slaughter the animals we eat.
Right.
They should have no fear of coming.
Okay, thank you very much, Dr. Adefemi Afolabi, Senior Lecturer, Division of Endocrine Surgery, University College Hospital Ibadan, and the founder of Thyroid Care Association of Nigeria. Thanks for joining us on this program to enlighten our viewers on the functions of thyroid gland, the prevention of thyroid diseases, and of course the effective management of those diseases.
Thank you very much.
You're welcome.
For having me.
Thank you, sir. Okay, so thanks for being with us on the program today. We keep on this show bringing topical health conditions that are preventable and what to do. The key message is whenever you found abnormal swelling around your neck, it might be thyroid, it might not be thyroid, but whatever it is, go to a hospital. They are going to find out what it is and treat it right on time. And the good thing is there are solutions to them. So, same station, same time next week. My name is Dr. Laz Eze. Bye for now.